Wait, 6.5% jump in health plan costs for 2026.
Yeah.
Highest increase in 15 years. Did they just declare, like, national patient pays more day without telling us?
Feels a bit like that, doesn't it?
Welcome to Expert Billing Talk. This is the Practice Profit series where we make sure your practice puts more dollars in your pocket. Today, we're doing a deep dive into some pretty crucial sources. Reports from Mercer, healthcarefinance news, Certify Health, Numerator, the list goes on. Medical economics, Payson, AMA, Invensis.
A lot of ground to cover.
Right. And our mission, to really unpack how these, seismic shifts in healthcare finance could hit your practice. We want to turn potential threats into maybe some surprising opportunities.
Absolutely. It's a critical time.
So let's kick off with that Mercer news. Reuters reported that employer health plan costs projected to surge 6.5% in 2026.
And that's the big headline, biggest leap in 15 years.
15 years. And it could even hit 9% if employers don't make changes, right?
That's the projection, without any plan design adjustments, yeah. A 9% spike.
Wow. So what's fascinating, or maybe terrifying, is how that translates directly to patient pockets.
Well, Mercer also notes over half of U.S. employers are basically planning to shift these rising costs straight onto their employees.
So we're talking higher deductibles?
Higher deductibles, yep. Increased copays, more coinsurance.
So for practices listening, this isn't just like another small increase.
No. It's more fundamental. It's really a reevaluation of how healthcare gets financed right there at the patient level.
So basically, patients are now operating as mini insurance companies for themselves. How's that for convenience?
Well, put it that way, yeah.
You mentioned this is a pivotal moment, a 15-year shift. What does that really mean for practices, like, on the ground?
It means this isn't just a bigger wave hitting the shore. It's like a whole new tide coming in. It demands a fundamental re-engineering of your financial processes.
Re-engineering. Sounds serious.
It is. I mean, just imagine Sharon at the front desk. Picture the sheer delight of her having to explain a new, maybe 9% higher deductible to a patient who just came in for a routine checkup.
Oh, man.
Yeah.
Sharon's going to need a raise. Or maybe a stiff drink.
Exactly. This moment right here, it's where being proactive with patients about costs isn't just, good practice anymore. It's really the new baseline for survival and for growth.
Okay, so that's the challenge side. But even with this looming issue, there's another side.
Yeah.
Right? An opportunity, if you're prepared.
Definitely. There's what you might call the reward side.
The reward side. I like the sound of that. What are we talking about?
Okay, so Healthcare Finance News highlights that practices with pre-service payment policies asking upfront, they actually collect about 20% more overall.
20% more just by asking earlier.
Essentially, yes. And Certify Health adds to that they found point-of-service collections are 70% more successful.
70.
When you're upfront with cost estimates and you offer easy, digital payment options.
It's almost like transparency and making it easy to pay actually helps people pay. Who knew?
Funny how that works, right? And if we connect this to the bigger picture, there's even more potential just sitting there.
Okay.
Numerator reports that HSAs, health savings accounts, they average over $3,000 in annual contributions. And FSAs, flexible spending accounts, add another $2,000 or so.
Okay, so $3,000 here, $2,000 there.
That adds up. It's a combined $16 billion in annual consumer healthcare spending, just in those accounts.
$16 billion.
Yep. So practices that actively promote using HSA and FSA cards right at check-in, they can tap into a really significant, often underutilized payment stream, just by making it easier for patients to use the money they've already set aside for healthcare.
The fabled $16 billion patient piggy bank. Just sitting there waiting for practices to politely ask for it.
Pretty much.
Because, patients always remember their exact HSA balance off the top of their head, right?
Well, maybe not always, but making it easy helps.
Okay, so those are the promising opportunities. But we have to be real. Let's pivot to the risk side of this new financial equation.
You do, and it's significant. Medical Economics reported that 38% of Americans, 38%, are now delaying or skipping medical care entirely because of cost.
Wow. That's up from what, like 27%?
Exactly, up from 27% just 2 years ago. And get this, even insured patients are pulling back. 37% of them admitted skipping treatment because they couldn't afford their share.
So nearly 4 in 10 potential visits just vanish. Not because they don't need care, but because of the cost.
Think about that impact. That directly hits your patient volume and, critically, your bottom line. Fewer visits, less revenue.
And speaking of hitting the bottom line, what about actually collecting what is owed?
Yeah, Payson found something pretty staggering there. 76% of patient-responsible balances simply go uncollected.
76%? That's huge.
It is, and it's getting worse, apparently. Collection rates from commercially insured patients actually fell, from nearly 38% in 2023 down to just over 34% in 2024.
So even when insurance covers most of it, collecting the patient's smaller portion is getting harder. Why? Is it just the cost, or are there other things making it complex?
Well, policy changes are definitely adding layers of complexity. Look at the No Surprises Act. The American Medical Association reported that, 85% of the independent dispute resolution cases, the IDR cases, they favored providers.
Okay, so providers are winning the arguments.
Right. But here's the kicker. Nearly 70% of health plans failed to pay even after losing arbitration in 2024.
Wait, what? They lost the case but just didn't pay?
Apparently so, in a huge number of cases.
Mm-hmm.
And looking ahead, CMS, that's Medicare and Medicaid Services, they're launching this Wiser pilot in January 2026.
Wiser, what's that?
It brings new prior authorization requirements in Medicare. And critics are already warning it could mean significant delays and more administrative burden for practices.
So not only are patients ghosting us on payments sometimes, but the health plans who actually lost the arbitration are just ignoring it too.
It seems that way.
It's almost as if they didn't get the memo. Or maybe they're just banking on providers being too busy, too swamped to chase down every single one. They'll just give up.
That could certainly be part of the calculation. It puts immense pressure on practices.
So faced with all this, patients skipping care, plans not paying, what actually works? How do practices navigate this?
The difference maker really is going to be preparation and technology. Smart technology.
Okay, like what specifically?
Well, Inventus found that using real-time eligibility verification checking insurance right at the start can slash claim denials by over 50%.
50% fewer denials just from checking up front.
Yeah. And it can shorten your account's receivable cycles, how long it takes to get paid, by up to 20 days.
20 days faster cash flow. That's significant.
Absolutely. And think about payment flexibility. Automated payment plans, easy-to-use mobile portals, keeping a card on file securely. These aren't just nice-to-haves anymore.
They're critical.
They are critical for improving your cash flow and giving patients the flexibility they need to actually meet their financial obligations. It transforms a potentially scary lump sum into manageable chunks, improves collections and patient satisfaction.
Okay, that makes sense. Technology and better processes. This is actually where a partner can make a huge difference. Human Medical Billing, for instance, is a full-service RCM partner designed exactly for this kind of environment.
Right, handling the complexity.
Exactly. They help practices navigate these exact challenges. And they even offer a free, no-obligation practice analysis. It shows you precisely how your practice can capture more of this revenue opportunity and really strengthen your financial health.
That kind of tailored analysis is invaluable right now.
Definitely worth looking into.
Yeah.
Okay, so let's try and wrap this up. What's the big takeaway for everyone listening?
I think the core message is that the Mercer report really confirms it. 2026 marks a crucial, maybe once in 15 years shift in healthcare finances.
Right, a big turning point.
And it presents both a rare chance for significant growth if you adapt, but also a looming threat of increased bad debt if you don't. It really depends on how your practice responds.
Preparation meets opportunity, or avoids disaster.
Something like that, yeah.
Okay. That's it for this deep dive from Expert Billing Talk, the Practice Profit Series. We're here helping your practice put more dollars in your pocket, especially in these changing times.
Stay informed, stay prepared.
Absolutely. Because let's be honest, if Sharon at the front desk basically has to run the Federal Reserve with her square reader now, shouldn't you at least be fully equipped to collect what you're owed?